Thanks for joining me today at Medics Without Jargons. So today I'm going to talk about chlamydia and sex. So what is chlamydia? Chlamydia is the most common sexually transmitted infection in the UK. And millions of people all over the world also have chlamydia. And the worst thing that they don't even know it. So what are the symptoms of chlamydia, you will ask? The unfortunate thing is that 7 out of 10 young people with chlamydia infection, they don't even know it is symptomless. And 5 out of 10 boys and men with chlamydia, they don't even know it. So most people with chlamydia will never even know that they have chlamydia infection. And it's such a very dangerous sexually transmitted infection. So the few that have symptoms, what are the symptoms of chlamydia? The symptoms include bleeding after sex, or bleeding when it's not their period. It's within, maybe they've had their period and after that they're still bleeding. Or they have vaginal discharge, or they have pelvic pain and soreness, or sometimes they have painful urination. You see, there's a difference in painful urination due to urinary tract infection. So this painful urination coupled with the fact that they are bleeding, that's a key sign that this could be chlamydia. So the question you're going to ask is, if it is symptomless, how often do you have to test for chlamydia? There are things you need to watch out for. There are things you need to know about testing for chlamydia. Now, how often you test is dependent on how old you are or how sexually active you are. So if you're mainly young people below the age of 25, my advice is that you need to be testing for chlamydia at least once every year. If you're sexually active, then my advice is that you need to test even more often than once a year. Because the unfortunate thing, like I said, is that you can have it and you might not even know it. So really, if you're under 25, you need to test at least once a year. It's easy to test it. It's easy to get the kit to test it. It does not cost you anything. The test is discreet. Obtaining the test kit is discreet. Most pharmacies in UK and most surgeries in UK have chlamydia testing kit. You don't have to pay for it. You just go in there, pick up the kit, go back to your home, follow the instruction, do the test, and send it out. If it comes out positive, they will test you the result. All you need to do is to contact your sexual health clinics or your GP surgery, and they will treat the chlamydia. As long as it's uncomplicated chlamydial infection, the treatment is easy and simple. Now, the other thing I want to say in a final note is, what are the complications of chlamydia when they are not treated? The worst thing you will want is to have a complication where you have chlamydia, it's symptomless, it hasn't been treated. Now, the complications of chlamydia that I'm going to mention in a minute. But before I mention, I'll ask you, please, have you subscribed? If you haven't subscribed, please do subscribe, because this is an encouragement. This will help me to release more videos. And if you have questions or you have any suggestions of any topic you want me to deal with, I'm happy to hear it. And so what are the complications of chlamydia? Number one is infertility. Some people, when they eventually get to the age where they want to have children and they're trying to conceive, they can't because of infertility. Chlamydia is one sexually transmitted infection that can cause infertility. The second thing also that chlamydia can cause is ectopic pregnancy. So even if you have taken in, there are chances that you might end up having an ectopic pregnancy, and that's not what you want. The other symptom complications of chlamydia is what we call pelvic inflammatory disease. Again, these are where they constantly having pain around their waist, a burning sensation around their waist. Even sometimes those pain can radiate to the back. And those are the complications of chlamydia that hasn't been treated. So really, there's so much link between chlamydia and sex. Thank you for watching. And if you're under 25, especially if you've not had a test for a while, my advice is it's discreet, it is simple, treatment is also uncomplicated. Thank you for watching.